The purpose of this video is to educate new classroom teachers on how to properly lift and transfer students. In this video, we will outline some of the important points to consider while transferring and lifting students, proper procedure of transferring and lifting, identify the points of an improper lift, and provide a video demonstration on how to properly lift and transfer a student and provide pictures of an improper lift. So we're going to start off with some main points. First of all lifting and transferring procedures are to be discussed with the PT to ensure that this process is done correctly and safely. The body mechanics of proper lifting are as follows. Number 1, before lifting, take your time and think about what you are doing, where you are going, and what muscles you will be using. Number 2, prior to lifting, establish a broad base of support with one foot slightly ahead of the other and your feet apart. Number 3, use good body posture with your back straight as possible and your stomach muscles tightened. Number 4, lifting should entail using the large muscles of the thighs, arms, and legs and not the small back muscles. Number 5, if lifting the student from a lower level, kneel or squat while keeping the back straight, bent at the knees, do not bend at the waist. Number 6, while lifting, keep the student as close to your body as possible as you straighten at the knees. Use large muscles of your arms and legs to lift the student. Keep your back straight and turn by moving your feet, keeping your whole body straight. Number 7, while lifting, be sure to support the student's body at key points, close to the student's center of mass. This includes supporting the student's trunk, shoulders, and/or hips as instructed by the therapist. Never grasp the student's arms or legs at points distant from the center of the body, for example, the hands or feet, and never pull the arms and legs to lift the student up. Number 8, if the student is needed to be carried for any distance, follow the instruction of the therapist as to how to hold the student for carrying. Keep the student close to your body and support the student's body where instructed. When completing the lift and transfer, place the student on the surface or in the equipment. Do not bend at the waist. Keep the back straight, bend at the knees, and keep the student close to your body until weight is on the support surface.
Other things to consider while doing wheelchair transfers are always wear appropriate attire. For example, you should never wear high heels or jewelry. Instead, wear comfortable clothes that allow for movement. Brakes must be set before transfers so it does not roll, which will result in injury. All straps and seatbelts must be removed. Leg rests may be removed or swung away to allow better positioning for the transfer. If student is being slid to a parallel surface, the wheelchair's armrest may be removed. And lastly, the wheelchair should be positioned an appropriate distance from the place you are moving them to. When starting a transfer, you are going to bring the wheelchair closer to the area that you are moving the child to. That way, it is easier for you to adjust them to the proper area. Next, make sure you have a safe amount of distance between the wheelchair and the chair to allow enough space to actually proper the student. If you have too much space or too little, it can cause issues during the lift and transfer. Before we lift the student, always make sure you communicate clearly to the student what you are about to do and check for understanding before the procedure actually begins. Also remember to support the student's center points such as their trunk, shoulders, and/or hips. Now we are going to insert a video demonstration of a two-person side-by-side lift method. Remember to always make sure that the therapist has approved the way you are lifting and transferring the student, so everybody is doing the proper method.
Now we will begin the process of lifting and transferring. First, we will make sure to activate the brakes on the wheelchair to prevent the chair from moving during transfer. Next, we will unbuckle the seatbelt.
Now we will get in place and explain to the individual exactly what is going to happen and where we are going to transfer her to.
So, Taylor, we're going to be transferring you from your wheelchair over to this desk chair right here. So how we're going to do that is we're both going to be on your side. We're going to have one arm under your leg, and then we're going to go behind your back and grab your arms to hold you in a steady position. Are you okay with us transferring you? Yes. Okay, do you understand how we're going to? All right, on the count of 3, we're going to transfer you. Ready? 1, 2, 3. All right, are you comfortable in the position? Yeah. Okay.
Now let's test your ability on what you've learned so far. What was wrong with the video demonstration we made? If you guessed the distance between the chairs, you're correct.
Now we're going to look at some other examples of how not to do a lift or transfer. We hope you found this video helpful for learning how to lift and transfer a student using a two-person side-by-side method. Please remember that you and the student's safety are the key goal during lifting and transferring, and by following these guidelines, you will be successful. If you have any questions, comments, or concerns, please contact your school to be given the proper information on lifting and transferring. And please remember, this video only pertains to the two-person side-by-side lift method. If you are looking for information on a one-person or three-person lift, you can refer to our other informational videos. Good luck with this upcoming school year, and we hope you are confident in transferring your children.